So for Asian blepharoplasty, there are different methods in which we can create a double eyelid. And creation of the double eyelid means that there is a connection of the skin with the underlying cartilage and muscle, so that when we actually open our eyes, the skin kind of invaginates in and thereby forming that crease. For a lot of, especially Eastern Asians, just naturally they don't really have a double eyelid. And so surgically what we're trying to do is recreate that attachment between the skin, the cartilage, and the underlying muscle. And there are basically three different methods. One is completely scarless, just suture technique. So what we do is that we kind of like evert the eyelid, and then just using sutures, we create that crease. It's rare that we really have patients who is a candidate just for that, because with a suture technique, the main way in which that double eyelid will fold and keep it kind of connected is the scar tissue that it forms. And when we use suture technique, we don't create enough of that kind of the raw surface area and internal scar to create a double eyelid that will last a lifetime. So for a lot of patients, they're really not a candidate for just suture technique. The second method is what we call minimal incision, which means we make between 3 to 5 very small incisions at the level in which we want the double eyelid to be. And then we use sutures to create that double eyelid. Because there is a minimal sort of incision, that fold is more stable. However, even with this method, especially if you have kind of a thicker skin or a lot of like fat, we can't really say that it's going to be permanent. And finally, the last technique is a full incision technique. And I would say good 60-70% of our patients are more candidate for a full incision. Because even for younger people, there always is a little bit of that extra skin that kind of hoods over the eyes that makes the eye look smaller. And so if we can cut out that extra skin, it always kind of like kind of rejuvenates the eyes more. But the main reason to do a full incision is that double eyelid is very stable. Because we're actually cutting along that double eyelid crease, it creates a larger surface area for everything to sort of stick down. And so that double eyelid becomes more permanent. So these are the three main methods of performing a Asian blepharoplasty and creating a double eyelid: suture only technique, minimal incision technique, or a full incision technique. So a lot of patients ask, how do I make my eyes look bigger? But you gotta be careful. It has to be balanced and proportional to the rest of your face. So whenever we talk to patients about strategy to make the eyes look more bigger, a lot of times what we focus on is how do we accentuate the eyes and keep the balance and proportion and don't change a whole lot of who you are. But basically when we talk about the eyes and making it like bigger, we got to talk about which direction do we want to make it bigger. So there is what we call vertical aperture, which means how much do they open up vertically, and the horizontal, how long are they? And so in terms of horizontal lengthening, because a lot of patients, they do want their eyes to look a little bit longer. There are two directions in which we can actually increase that size. We can open up the inner corner, or we can open up the outer corner. And everybody's really different. But a lot of times we do a medial epicanthoplasty, which means opening up the inner corner. For a lot of Asians, they do have what we call an epicanthal fold, which means there is kind of an extra skin that tends to hood over the inner corner of the eyes. So what it sometimes does is that it kind of cuts off the inner corner of the eyes so that the eyes look shorter. And so medial epicanthoplasty, which is an incision in the inner corner of the eyes to open that up, really does help in patients who are really candidates for it. Not everyone's a candidate for it. For example, if their eyes are already long to begin with, or if their intercanthal distance, which means the distance between the two eyes, are close already, you don't really want to open up the inner corner because then everything would look too close together. So that's medial epicanthoplasty, which means opening up the inner corner. The outer corner is what we call lateral canthoplasty. And for some patients, the outer corner of the eyes gets cut off, or it's kind of short. And the limit as to how much we can open up the outer corner really is dependent on how close that bone is. Because the limit of how much we can open up is right at that bony starting point. And so for some patients, they really are a good candidate for what that lateral epicanthoplasty. The vertical aperture, a lot of times for Asians, they do have a congenital ptosis, which means that the eyes don't really open up all the way. And that's really because just innately, there's a muscle that we use to open and close our eyes, and that's kind of innately weak. And so what we do surgically a lot of times, especially when we create a double eyelid, is that we tighten that muscle, what we call the levator aponeurosis. We tighten that muscle so that even if the muscle's weak, because it's been tightened, that more of the eyes open up. So that increases that vertical opening. So this is all like completely what we call 360-degree direction in which we can kind of open up the eyes. But as I said, it's really important to make sure that we don't overdo these type of procedures because it really has to be balanced with the rest of your face. If you enjoyed this video, please click like and subscribe to our channel. A lot of times I see patients who don't really have a double eyelid that wants to create it non-surgically by using whether it's tape or glue to kind of like form and create that double eyelid. So the way that that works is by making the skin below where the double eyelid is a little bit kind of thicker and stiffer so that when we open our eyes, because of that tape and because of that glue, the double eyelid kind of forms. One of the problems that we do see for people who use the tape and the adhesive glue though, a lot of times what we see is the side effect of it, which is it makes the skin a little bit more rougher and thicker and also stretches out the skin more so that the skin sags a little bit more. So for people who want to occasionally use it when they go out, I think it's perfectly fine. But long-term usage, we advise against. I mean, if you really want a permanent double eyelid, then surgery is the way to go. Hi, this is Dr. Peter Lee, and today we're going to be talking about upper blepharoplasty or eyelid surgery. And I'm going to be addressing specifically some of the more common questions regarding this procedure. The age limit for an upper eyelid surgery, a lot of times we're doing it for two reasons. One is for age-related sagginess, so the changes that occurs in our upper eyelid as we get older. And there really isn't any age constraint for an upper blepharoplasty as we get older. But the other times in which we're doing blepharoplasty is to create a double eyelid on Asian patients. And as far as that is concerned, creation of a double eyelid, it really kind of depends upon how mature and developed that eyelid is. We think typically that you shouldn't really do an upper blepharoplasty until you're kind of at the age of 15, 16. So in terms of how long the result lasts for, when we talk about like doing an upper eyelid surgery for, aging process, then again, it kind of depends upon the individual. Some people, they sag a little bit quicker than others, but usually we do talk about the effectiveness of the sagginess, the correction of the sagginess for about good 10 years. For an Asian double eyelid surgery, I mean, that's permanent, creation of a double eyelid. After surgery, it's really not painful. The surgery itself is pretty straightforward, and like any surgeries, I mean, there's always kind of a built-in innate risk with any type of surgeries like this. But because the upper eyelid surgery is done not under general anesthesia, but under twilight sleep, it's much less involved than some of the other bigger surgeries that we do. But in terms of like probably the most common possible side effects and risks, I mean, we spend a lot of time addressing symmetry because for a lot of people, just naturally the two eyes are always different, and trying to make them as symmetrical as possible, that's what we actually spend a lot of time on. There are a lot of patients that we actually do upper eyelid surgery for functional problems, not just the appearance and the cosmetic component. So for example, there are some people with what we call ptosis, which means that the eye itself doesn't open up quite as much as kind of an average patient's. So some of the slang terms that we sometimes use are things like lazy eyes or sleepy eyes. And so ptosis correction is a functional surgery, meaning if you have ptosis, your field of vision is dramatically decreased. And therefore, doing the upper eyelid surgery and correcting that ptosis really does impact functionally how much you can really see. So some of the other sort of functional problems that happens is that if there's a lot of sagginess to the eyes, especially at the corners, that's when, again, you can have problems with visual field. And so cutting out that extra skin really does kind of open their field of vision up so that patient can see more in terms of their overall perspective. If there's significant sagginess to the corners of the eyes, then it does help with the crow's feet. But a lot of times crow's feet is generated by activity of the muscle. And certainly we don't really touch those muscles. So even after the upper eyelid surgery, there's going to be crow's feet wrinkles. So post-operatively, the recovery time is really dictated on how much swelling that you get. I mean, if somebody bruises easy, then you can get some bruising, but it's really that swelling. And because the eyelid skin is so thin, it does swell up more than other parts of our body and face. So one of the things that we really recommend patients to do, especially for that first week after surgery, is to try to rest their eyes as much as possible. And that does mean like not being in front of the computer too much, not being on your phone too much. The more that the patient can actually rest their eyes, which means closing the eyes and applying ice compression, I mean, that's something proactively that you can do to kind of like speed up that healing process. But on the average, when we kind of like take a look at the overall patients that we have, it does take about 3 weeks for good 70 to 80% of the swelling to go down. In order for like 100% of the swelling to go down, it does take several months. But because there's really not much pain, I mean, for most patients, just extra strength Tylenol is sufficient for pain control. And then as far as like taking a shower or washing the face, the patients can do that the next day, as long as they're careful around the suture lines. If you like this video, then please press like as well as subscribe. Thank you. Whenever we talk about creation of a double eyelid, there are several things that we talk about. The first is, where does that double eyelid start? In the inner corner. The second is the overall shape of the double eyelid. And the third is, how big do we create that double eyelid? So if the double eyelid starts from inside the inner corner, then it's what we call tapered. And that's more of a kind of a natural look. For a lot of Asians, the second is hybrid, which means it starts neither at the inside of the inner corner or the outside of the inner corner, but starts right at that corner. And that's what we call hybrid. So it's still very natural because it's kind of that tapered, but because it starts right at the corner, the eyes look a little bit longer than if it's just purely tapered. The third choice is parallel, which means that the double eyelid starts from outside the inner corner. For a lot of Asians with a strong epicanthal fold, however, we do have to perform a medial epicanthoplasty, which means opening up the inner corner, to be able to create that parallel look. The parallel look will make the eyes look longer. The only downside to that is that perhaps it's a little bit more dramatic than like a natural look that you can kind of see with a hybrid or tapered look. In terms of the shape, usually we talk about whether it's kind of circular versus oval shape. Oval shape means that the size of the double eyelid is a little bit thinner towards the inner side of the eyes. And then as the double eyelid sort of goes towards the end, then it's a little bit wider. So this is what we call an oval shape. If the size of the double eyelid is kind of the same all the way through from starting point to the end, then that's more circular. For a lot of patients, I would say the oval shape is more kind of natural and suitable for them, because not only does it kind of like make the end of the eyes a little bit more open, but that's usually the shape of the eyes itself naturally. For more of a rounder look, it's more for people with already kind of a big eyes that kind of wants to look maybe a little bit more kind of like softer and kind of like more kind of cuter look. That is to have that double eyelid kind of stay the same throughout the entire length of the eyes. So that's the choice that we have in terms of the shape. And then in terms of the size, what we talk about is from the eyelashes, how high up do we create the double eyelid? For a lot of patients who want more of a kind of a natural double eyelid, we are usually talking about anywhere from 6.5 to 7.5 millimeters. For people who want it a little bit more dramatic than that, it's 7.5 and above.